Glutathione is basically the master antioxidant. Oxidation and inflammation is probably the #1 culprit. We know that if we can address that, we can have significant resolution of disease and slow down disease processes. And of course, that's what glutathione does. It prevents that oxidation. If you think about aging, for example, the whole process is due to oxidation and inflammation. So we find, at least from the research that we've done, aesthetically, glutathione will help slow down the aging process. It rejuvenates the skin. Antioxidants are very important, and glutathione is probably the most important antioxidant. And it's kind of opened up a brand new window. It's used for wrinkles and to increase the strength of the skin, so far as preventing that elasticity of the skin. It's also used in treatment of acne. People who tend to get chronic infections, autoimmune diseases like lupus and rheumatoid arthritis. There have been studies on improvement of Parkinson's disease symptoms, as well as Alzheimer's disease, and improvements with symptoms of autism, directly also with cancer, cardiac disease too as well, complications related to diabetes. There's a host of other disease processes. In fact, at some cancer facilities across the country, they use it quite often in post-chemotherapy treatment patients to boost their immune system.
We actually had a client that she was having issues with depression. She only had one. The next day she came in and she was like, I actually didn't go home and cry myself to sleep like I have every other night this week.
So there's multiple studies on the health benefits of it.
And I have called on Dr. Guidry for at least 20 years. And so I saw him when he was younger than he is now. And Dr. Guidry's that type. He does a lot of research on things. Anything he brings to his practice, even the Medi-Spa or his practice, he's always been really well thought out, because I have called on him with multiple classes of drugs over the years, and he's always been well versed. Before I even come, as I start to talk about something, he will already know a lot about what I'm talking about. So I went and read then more about the glutathione, and kind of enlightening. I had no idea that it was so essential for your body, and that it seems to be depleted as we get older. His results, and then what I read, it was impressive.
I've tried it myself. I've noticed a significant improvement in how I feel. I've been told I look younger, although I don't feel it necessarily.
And I said, well, what are you doing? He looked younger, he had more energy, he looked younger, He looked younger. He looked like the old Dr. Guidry and had a pep in his step. He was different. He was the older, the younger guy that I used to know.
Quote unquote, provide you with some semblance of the fountain of youth. Why not? Glutathione, a lot of people have read about it. There's oral supplements of glutathione. But what we've noticed is the oral supplements that you don't get adequate absorption in the GI tract.
Glutathione is most effective through an IV infusion. It's going straight into the bloodstream. You don't have to, it doesn't have to go through any system to break down. It's already exactly where it needs to be. Then it just has to find the damaged cells.
And there's certain supplements that actually help to improve the absorption of glutathione, and those supplements are basically vitamin B12, vitamin D, folic acid, and selenium. And by taking those on a daily basis, that will help to improve the amount of glutathione that you have in your diet. And we do carry those products also here in the office. The other thing I do encourage you to do, so far as diet is concerned and the supplements, is very important in your diet that you eat quite a bit of fruits and vegetables, glutathione-based vegetables. Typically things that you want to eat is kale, spinach. If you're going to do meats, then I highly encourage you that you do non-processed meats, basically antibiotic-free, steroid-free meats, as well as broccoli, kale, spinach. Those things basically has a little bit more glutathione than other vegetables. You sit in our spa and we try to make you comfortable and relaxing environment. And most people bring their own music. If you don't, we have music for you.
You get to relax in a nice comfortable chair for about an hour and a half, maybe 2 hours, just depending on the patient and the flow.
Well, when you come in, we actually have someone will start an IV on you.
A very small butterfly, everybody's favorite needle, is inserted into the IV site in this area. And that's it. You get to just chill, relax, take a nap, read a book.
And after about an hour, we disconnect the infusion and you're good to go. There's essentially no downtime. There's no risk involved. There's always possible side effects, but we observe you on a very regular basis to make sure there's none.
And it's going to vary from patient to patient. Most people, when they leave here, they feel energized, they feel more awake. Longer results will be after about probably the third or fourth infusion.
On average, we recommend that you get 10 infusions. And the best way to split it up is at least twice a week. And of course, we juggle things around your schedule. And you will see the maximum benefit of the intravenous glutathione.
But you can continue after that, or what's best for you. You know, if doing one a week or one every 2 weeks is working for you, then great.
We've been very pleased with it. If you'd like to come out and give it a try, I encourage you to do so.